if we broaden out the discussion then, Rhian, let's talk through the sort of common excuses people throw out in terms of why they don't think intravascular imaging has value. So what do you think about the argument around time and cost?
I guess my perspective is what the patient's getting out of that. A few minutes or a few seconds even to get an IVUS run and get an ideal size of what their vessel is more important than just dropping a stent that you think, quote unquote, fits it angiographically. So I think if that's the reason that you're not using IVUS is because of cost or time management, you're going to save a lot of time. I think in the long run, you're going to make the patient a lot happier knowing that their stent's appropriate for them.
Yeah, well, it's reimbursed. There's RVUs, so and actually, time I think is it's the opposite. I think time is generally saved because you give yourself a roadmap for your PCI. You understand what stent you want. You know where it's going to land. You know what post-op balloon you want. If you follow that script, your procedure is actually very efficient. So I think it's probably time saving. Paradoxically, okay, it takes a couple of minutes to put it together and put it in. But if you set the device up at the start of the case as a routine thing, that doesn't add anything. And actually to take a run, analyze it, and do that before and after a stent, it's only a couple of minutes. And as you pointed out, for the patient's long term, to spend an extra 4 or 5 minutes during a procedure to guarantee a 5 or 10 year PCI result, I think that's time that's very well spent. And if you're really obsessed with time, I mean, reduce your turnover between patients in the cath lab and focus your energy there, rather than nonsense about not doing something that's going to make a patient better.